Hi guys! Welcome to today's video. In today's video we're not talking about fragrances. Actually, this video is something I wanted to make just because I've been researching this kind of videos because I got into I was prescribed a new medication, and I find this kind of experience videos really helpful. And I have a new medication now. I'm taking Prozac and then I'm taking olanzapine together. And basically olanzapine I cannot tell you guys enough about yet because I just got prescribed it and I'm still getting used to it and seeing how it affects me and things. I'm taking it for bipolar disorder type 1, and I have been on Prozac for over 3 years now. I think this is the 4th year of me eating Prozac for depression and OCD especially. So I have OCD and I just wanted to make a video about my Prozac usage because I feel like I can do a review right now because I've used it for such a long time and it's been my ride or die bitch for 4 years. So this video is going to be positive, so if you don't want to hear anything positive about a drug, then maybe you shouldn't watch this video, but I just find it really interesting to watch these videos, especially if someone's prescribed something for the first time in their life. You just want to go and research, and honestly I felt like I need to give you guys my honest opinion about the drug called Prozac because I've been on it for a long time and I had to switch medications, and Prozac was the one that worked for me. So I really wanted to make this kind of review video. So basically, at first I was prescribed escitalopram and citalopram at different times, and they didn't work for me. They didn't work for my OCD side of things. I have contamination OCD, which means that I need to wash my hands oftentimes, and I have these rituals, and I'm afraid of getting some sort of contamination. And I have these kind of really distressing thoughts about contamination sometimes, and that's how my OCD manifests. And I also have had depression in the past, so they started to treat my depression and OCD with escitalopram and citalopram, and I wasn't responding to the treatment well, so that's when they changed it into Prozac. So I've got experience from 3 different medications, but Prozac was the best for me, and I'm gonna tell you guys how it affects my whole well-being. So basically, when I started it felt a little bit weird, and I remember getting this kind of fuzzy feeling when they started it, and it's the starting symptoms. You shouldn't be afraid of the starting symptoms because they go away usually when you use it for a longer time. And for example, for me, my startup symptoms basically lasted for I think a week, and then I felt completely normal after that. So from startup symptoms, I remember having fuzzy feeling, kind of my brain was a little foggy, if I remember correctly. And my pupils were really large for a little while when taking Prozac. And that was really annoying because I was really sensitive to the light. It felt like I was a vampire for the week, but then it kind of calmed down, and now I feel like it's something that doesn't even show, or I don't have enlarged pupils anymore. So those were the only side effects I noticed in the startup of the fragrance of the medication. I'm sorry, I have a fragrance channel, so I don't know why I said fragrance. The medication, yeah. The only thing I noticed about Prozac startup was the enlarged pupils and also the kind of fuzzy feeling. After that went away, it really started to work really well for me. I'm sorry, I have a cough and it's not related to the Prozac, I'm just a bit sick. But yeah, it really does help with my OCD loads, and none of my former medications before it did anything for my like contamination OCD. I still had as many like OCD thoughts as I had before, and like they didn't do anything, and it was really like taking huge chunks of my life. OCD was hijacking most of my like daily routines, and it was really like disempowering for me, and like it really made me feel super bad, okay? And like I felt depressed because of my like OCD, so it was this vicious cycle. And Prozac really helped me to get over it, honestly. Like nowadays when I take Prozac, like I have like 0 to 2 OCD thoughts a day, whereas I used to have like 4 hours non-stop OCD thoughts all the time, every day. So I think that that's like super good, okay? And the other thing I really like about this drug is that to me Prozac didn't do any problems with my sex life. Escitalopram and citalopram made me feel like I had some problems in my sex life stuff, and I'm sorry, this is a really real video, so you guys are gonna hear about it. Like I couldn't get turned on no matter what, and on Prozac like I don't have that problem at all. Like it doesn't it works for my OCD, and it works for bulimia really well, like that kind of like impulsive bulimic thinking, and depression also, but it doesn't like tone down my emotions, and that's like super great about it. So I think that fluoxetine is like the best thing for me. But there is one side effect I want to talk about that I've noticed while on it. So it kind of does make my liver values go a little bit high up, okay? So that's a problem that I think is attributed to Prozac, because I don't use other drugs than that and olanzapine, and like my liver values are a little bit up, not much but just a little bit, like my GFR levels are a little up. So that's a problem. And another problem is like my triglycerides are a little bit high up, okay? So there's some blood work stuff that it does kind of like affect, but because it's otherwise such a good like a drug, I don't think that that's like the reason to stop it or anything, and neither does my doctor. Like it really helps me in my daily life, and it's a super good medication in my opinion. It's the best one I've ever been on, and like it doesn't kind of like, I feel like myself when I use it, but the only thing that it does is kind of like it tones down my obsessiveness. It tones down like those obsessive thoughts, and I've heard from so many people that it's like the only medication that really helps for OCD. And I've talked to like maybe like 10 different people with OCD. So I'm just telling you guys that for me personally it does really work for that. The only other downside that I can kind of think of might be a slight weight gain. Like I think I've gained a little bit of like that water weight that you get when you start using some medication. But mainly my weight gain is due to my eating habits being a little off, okay? But I noticed that it does kind of give you that water weight, like you get a little bloated from it. So that's another little thing, but it doesn't bother me, and I honestly feel like I look pretty good still on it. And now at this moment I'm taking Prozac for the OCD, and I'm taking olanzapine because when you are bipolar, they just diagnosed me with bipolar type 1. When you are on bipolar, or like you have bipolar, you need to take 2 medications. You need to take one that kind of like offsets the dopamine levels a little bit so you don't get manic, and in my case that is olanzapine. And you need to take that depression medication, or like not everybody needs to, but I need to, okay? Like I get depressed without Prozac, okay? And mainly for me, even more than it is for that depression, like it does kind of like cure the depression also, but for me it's mainly for my OCD. Okay, there are different ways they can use these drugs for different kind of situations. So yeah, personally I feel like it's definitely a good medication, especially for OCD people or people with eating disorders or people with obsessive compulsive things or impulse control issues. Like I feel like it works great for me, and of course this is all something that you should just try for yourself, because not everything goes the same for everyone. Personally, it really works for me and it has worked for me great. The only thing is it offsets my blood work a little bit, like as I said. And otherwise I'd give it like 10 out of 10. I think it's 9 out of 10 because it does offset the blood work a little and it does give me a little bit of bloating. But those are like the only two things that Prozac does for me negatively. All other things are positive, and honestly, like my life has changed so much with this medication, and like I'm super happy to have it. And they're still kind of like trying to find my perfect medication thing for, because they diagnosed me with bipolar. They thought that I was depressive and like unipolar, that I had unipolar depression. And unipolar depression is treated, as I said, differently from bipolar. So that's why they're trying the olanzapine with me. And honestly, so far, I think it's working okay. Like I have a really small dosage of olanzapine, 2.5 milligrams, which is like super small dosage of it, to kind of like offset the dopamine levels so that I don't get manic, okay? Because by itself, fluoxetine can actually cause mania for people who are like bipolar. So it's kind of like something that I can't use by itself. But when I have like a safety net type of medication like olanzapine there with it, then I can like use it. And yeah, I might do a olanzapine video at some point if people are interested in these kind of videos. I just wanted to put this out there because when I was researching, like I feel like there's all these kind of like negative reviews about medication, but I just wanted to make my own because I really love like Prozac. It has changed my life. It's my best medication that I've ever been on, and it works great for me, and I just wanted to put that out there. If you are suffering with OCD or or like eating disorders and generalized anxiety, depression, it might be a good medication for you too. I'm so sorry. But yeah, and I do hope my new medication is gonna work. Like, I don't know yet because I've been on it only a week. So far it's going good, but I don't know. You know, everything is always like you need to test things out for a longer period of time to see if they actually work. But I might make that olanzapine video at some point once I've kind of like gotten accustomed to it and once I've seen what it does to my body and my mind, okay? So yeah, I hope you guys liked this video and I see you guys in my next one. Okay, bye!